Kia ora koutou katoa. Today I will set out our plan for the next steps in our Covid-19 response, including details of the phases of our public health management of Omicron and what that means for the testing and tracing process. We've begun a new chapter in our fight against Covid-19. Omicron is here, and we have changed our strategy to minimise Covid-19's impact on people and protect the critical systems that support our health and wellbeing. Almost no country in the world has escaped Omicron, and New Zealand is no exception. But where we can be an exception is how we minimise the virus and protect our people from it. Our systems have adapted at every stage of the pandemic, but you have all played a vital role too. New Zealanders step up when there's a job to do, and this has served our communities well through the pandemic. Our high vaccination rates, the hard work of our public health team, and the COVID protection framework have meant we have been able to do what many countries around the world could not do. We've reduced the spread of Delta, emptied our ICUs of COVID cases, and we're now in a good position to manage the spread of Omicron. From what we've seen overseas, we know Omicron is the most transmissible COVID variant yet, so we expect it will spread fast, causing case numbers to grow rapidly and putting our health system and other infrastructure under considerable pressure. International reports suggest new cases from Omicron double every 2 to 4 days. This means a 10-case outbreak could reach 1,000 new cases per day in just 6 to 12 days. We have planned for a high prevalence scenario where cases could be in the tens of thousands per day. I know that these sorts of case numbers will sound scary to many people. 2 years into this pandemic, many of us are still unaccustomed to having COVID around us, but it's important to remember that COVID-19 is a different foe to what it was in the beginning. The Omicron variant is markedly less severe than prior variants. One US report suggests the hospitalisation rate is 10 times less than Delta. Its transmission and severity is also reduced by vaccination. So for most people, it can be a mild to moderate illness that you can manage at home. We also have the advantage of watching and learning from other countries. Most other countries have had to get boosted in the middle of their outbreaks. Our plan has given us a head start, and nearly 60% of eligible New Zealanders have now had their booster, and 1 in 5 children under 12 have had their first dose. I'm particularly pleased to see that over 73% of eligible people over 65 have now been boosted, and every DHB is on track to complete their booster program in aged residential care next week. We need to use the coming weeks before the virus could significantly take off to get as many people boosted as possible. Getting boosted will play a major role in preventing serious illness and keep pressure off hospitals. If it has been 4 months since your second dose, you are due for a booster. Please go to Book My Vaccine to make an appointment, or simply go to a local drive-through vaccination clinic, GP or pharmacy. The Health Point website has a list of all the vaccination sites in the country. Vaccination sites are open today across the country, and we will be standing up additional surge capacity this week in anticipation there will be additional people who will now be wanting to make sure their vaccine is up to date. And for those with you with children aged 5 to 11, all children aged 5 to 11 can now be vaccinated, and I encourage parents and caregivers to seek out information to help you make that important decision. Already, around 20% of children have been vaccinated or are booked to do so. And now, a little more detail on our national approach, as Omicron is unlikely for Omicron. Last week, the Prime Minister talked about the fact that through the course of managing Omicron, we have changed our strategy to minimise its impact on people. As case numbers grow, both testing and isolation approaches will change in response. We have been planning for 3 phases for Omicron. This plan sets out the actions we will be taking in testing, contact tracing, case management and isolation, in quarantine, care in the community in response to Omicron in our communities. Phase 1 is where we are now, and we're doing what we have successfully done with Delta, using our tools from a stamp it out approach. This will all be familiar to you. The tools we have used to stamp out outbreaks in the past can also be used to slow the start of an outbreak, giving more time for people to get boosted. And that's why we are currently taking an intensive approach to contact tracing, including tracing secondary contacts. We are still asking that everyone who is symptomatic be tested at a community testing station or primary health provider. If you are required to isolate, you will receive advice and, if needed, support to do so. At this stage, you will need to isolate for 14 days if you are a case and 10 days if you are a contact. These intensive measures can be sustained while numbers are low. Once Omicron becomes established in the community, we will adjust our approach under Phase 2. In Phase 2, our public health efforts aim to slow the spread of the virus. This means reducing the number of cases to a level our health system can cope with. Importantly, because of vaccination and systems improvements, we are in a much better position than we were 2 years ago. The system will focus more on identifying those who are at a greater risk of severe illness from Omicron, which will be a small percentage of cases. As has been the case since the early days of COVID-19, we need to continue to adapt our public health response to safeguard the health and well-being of New Zealanders, and when COVID-19 changes, we change. Any rapid escalation in case numbers will put pressure on our resources and will require us to shift from identifying all infected individuals to being more targeted to those most at risk and those needed to keep the country going. At this stage, most people who are able to will start to be managed through our digital tools. Support from health and welfare services will be provided as required. Text message notification for positive cases will begin at this stage, with phone support still available for those that need it. Contacts will also be notified by text message. Household contacts will be actively managed, with close contacts requiring a day 5 test. As part of the text notification, individuals will receive a link to an online portal called the Covid-19 Health Hub. This will provide tailored health advice and resources on everything a person needs to know in clear, translatable and accessible formats. The Ministry and GPs are already working to identify those who do not have internet access or capability, so that when they become a positive case, they will automatically be flagged to receive a phone call or outreach service to connect with them. If people cannot access online resources, they can still get support from other channels. Healthline remains a key communication channel in responding to the pandemic and can help you with clinical and non-clinical advice. You can reach them on their dedicated line, 0800 358 5453. These measures will slow the spread of the virus, but they shouldn't disrupt critical services that underpin our well-being, like our food distribution or electricity generation systems. It doesn't make sense to take action on one public health threat only to create another threat to our well-being. We are currently in the process of identifying critical sectors, and we will have more information on this soon. Generally, workers in critical sectors are those who are required to undertake their role in person at the workplace and in a role that must continue to be performed to either prevent an immediate risk of death or serious injury to a person or animal, or prevent serious harm to significant numbers in the community. This is ultimately about ensuring the well-being of all New Zealanders. This has been the principle of our COVID-19 response right from the beginning. We will continue to manage testing of symptomatic people and close contacts at Phase 2 with PCR testing, but we will be enabling a test to return for asymptomatic critical workers who are close contacts of cases by using rapid antigen tests. These people, like our healthcare workers and those working in food supply and infrastructure, are key to our COVID-19 response and also ensuring New Zealanders can continue to access the services they need. Strict protocols for those testing to return to work for critical workers will include daily symptom checks and daily rapid antigen tests prior to commencing work, strict use of a medical mask put on before entering into the workplace, changed as needed during the day, and strictly complying with any infection prevention and control protocols at work. When the mask is removed, for example, for eating and drinking, physical distancing must be maintained. Eat alone or in a well-ventilated space where possible. Travel alone to and from and around work or between jobs. ensure good ventilation when in small spaces, and masks must be worn by everyone present. Continue regular workplace surveillance testing if this is already in place. If symptoms develop at any stage, the worker will follow the public health advice for close contacts with symptoms. Testing remains a cornerstone of our response, but when and where and how we manage our testing will change once Omicron becomes seeded in the community due to its highly infectious nature. Rapid antigen tests will become the go-to testing tool. They perform best when case numbers are high and can give a quick result without drawing on laboratory or transport systems. The use of rapid antigen tests will enable PCR testing to be protected for use in key workforces, such as healthcare, for surveillance at the border, and as diagnostic process in hospitals and acute care settings. We currently have good stock numbers of rapid antigen tests and will release more details on the application, distribution, supply and funding for them in the coming days and weeks. We are already in the process of preemptively supplying rapid antigen tests to healthcare sectors, organisations with critical workforces such as energy and food supply, among others, and providers who work with vulnerable populations, including Maori and Pacific providers. Critical infrastructure businesses that have eligible workers deemed to be critical workers within that organisation will be able to order rapid antigen tests from the Ministry of Health via an online portal. Specific guidance on the process for businesses and critical sectors will be distributed in the coming days. Importantly, as the Prime Minister previously said, testing will remain free and available when you need it. At the third phase, our public health response will be about minimising a widespread outbreak. When cases are in the tens of thousands, we will then make further changes to contact tracing. Locations of interest and push notifications will be paused, but keeping a record of where you've been by using the COVID Tracer app will be important as it is now, so that if you can get sick, you can identify where you were. Public health units will be focused on managing the outbreak in very high-risk settings, such as prisons or aged residential care. It's worth noting that we don't expect to be at this situation in just a few weeks. Self-service tools for contact tracing and rapid antigen testing will be important to help us respond to the high volume of Omicron cases. The care and the community model will see the majority of positive cases supported to self-manage at home, and clinical care and welfare support will be available to you and prioritised as needed. Your GP has an important role in this as a person who knows your individual health needs and how COVID-19 may impact you. By identifying patient cases early, we can effectively plan and ensure our hospitals and primary care providers are freed up for our vulnerable communities. Other technology solutions are under development and will enable the upload of rapid antigen tests results and to view test results and vaccination records. This enables those who are digitally connected to have access the information they need, but it is important to note that, as always, public health units will be available to respond to complex outbreaks, and iwi, Pacific providers and other NGOs will provide whānau with care and support. These technology solutions are being developed at pace, and more information on them will be available over the coming weeks. Through the course of each stage, we have a test-to-work regime that will allow our critical workforces to keep them going over the outbreak. Today we've gone through the details of public health operations so that everyone understands that the response will change as the outbreak does. But our message to the public is simple. Get boosted. Wear a mask in indoor settings. Follow the basic hygiene, the difference to us as a collective. Omicron is now in 80 countries around the world. By delaying its arrival here, we've had time to kick off with boosters, vaccination for children, and to prepare our public health response. I encourage everyone to use the coming days to take steps at home with your family, neighbours and community to make a plan. Resources to help you do this are on the Unite Against COVID website. Dr Bloomfield and I will now take questions. Jessica.
Minister, what do you say to people who are looking at these rules and say, as they stand at the moment, they could be facing weeks in isolation if they've got a large household? What do you say to those people where it's just not possible for them to hire, go to a batch or to stay with friends?
So at the moment, we are taking a conservative approach to our contact tracing system so that we can really minimise cases in the early stages of the outbreak. So it'll be very small numbers of people impacted by the longer isolation time for cases and contacts. What we've shown today is that we will change that as the outbreak changes and the numbers of people impacted by those become larger.
Is a close contact?
So a close contact is currently defined as someone who has 15 minutes of face-to-face contact with at a 2 metre distance. As we've indicated in our plan, that definition will evolve during the outbreak, and our resources will be more focused on those at the greatest risk.
Just going by the timeframes. Just going by the timeframes you mentioned at the beginning there, it looks like we're going to be in phase 2, probably by Waitangi weekend. Are all of these things in place for you to roll out, like the texts for Waitangi?
Firstly, it is not a foregone conclusion how quickly the Omicron outbreak will spread. And it's really important to note that as we look around the world, we see places that haven't got into the level where those phase 3 measures might need to be used. The actions that we take now, in terms of boosters, in terms of masks, will influence the time it takes to get to those other levels and the ultimate time we spend at those higher levels.
The government commandeering all stocks of rapid antigen tests from private businesses?
That is not the case. We have made sure that we are purchasing rapid antigen tests for our need, but I'll leave it to Dr Bloomfield to outline the process for purchasing rapid antigen tests that we're using.
Thanks, Minister, and kia ora koutou katoa. So just to be clear, we're not commandeering all the stocks that private businesses have. We have discussed with our 3 main suppliers, which are Abbott, Roche and Siemens, that forward orders of tests that haven't yet arrived in the country, that those be consolidated into the government's stock, so that is there for the whole country, including private businesses. We already have processes in place to supply businesses with tests if they are using them at the moment, and that will continue, and in particular to support private businesses and the public sector to maintain critical workforce, including through that return to work approach, but also to make sure that our rapid antigen tests are used where they are needed. And this is an interim measure while, as you know, there is extremely high demand on supply globally.
Is that fair that you've gone over and above businesses that have had orders in for weeks or months and said, hey, send them to us, we're more important?
Actually, we've all had orders in for weeks and months, as have other countries. The issue is there is a gap globally between production and the orders that countries and companies have right around the globe. What we are wanting to head off is the sort of situation we have seen in other countries, including in Australia, where rapid antigen tests end up in the wrong place and are not there to support the overall societal response. We have been and will continue to work closely with businesses to make sure that if they need access to rapid antigen tests, including now, then they can get those in the meantime.
Barry.
Dr Bloomfield, it would seem that you are commandeering it and saying to business, the Ministry of Health knows better how to handle them than what business does.
Well, the Ministry of Health is purchasing on behalf of the government, and that is to support the overall plan which the Minister has just outlined. Many businesses already have tests onshore, and we're not requisitioning those or doing anything like that. The issue that we are all facing is we have orders in, for example, we have orders in for around 40 million tests between now and the end of February. So far, we have confirmation for only around a third of those, around exact dates and numbers and when they will arrive. This is the same for businesses. What we have said to those suppliers is, in the meantime, we will ensure that we are getting confirmation of those orders and getting them onshore on behalf of all of New Zealand, including businesses.
You're taking the control away from business.
Well, that would be the case if we weren't working with those businesses, which we have right through.
And it's
around
not clear. It is not clear that those businesses placing small orders of 5,000, 10,000 in the global market, the way it is, that those would have been filled, actually. Jane?
What is the actual threshold? What is the actual threshold to move into phase 2? The definition in the plan just says when there are more cases circulating, but given the changes that will then come in, at what point, do you have a number? Is that a cabinet decision? How will that be made?
This is an operational plan, so no, I don't imagine it is a cabinet decision, but it is a matter of looking across these systems, testing and contact tracing, and very carefully evaluating the level of demand in those so that we know when we need to change, and we'll be indicating prospectively to people as we see that's likely to happen.
Is that at the point where systems become overwhelmed, that it's too much to keep contact tracing?
The plan is designed to make sure that we transition into new systems that can cope with demand, because indeed the challenge of Omicron is a really high demand that's there, so it is to avoid the overwhelm.
Can you be a bit more specific about the trigger point? Because phase 2 is quite different from phase 1. It means different things, including the isolation, including the test to work. At what point will ministers or the government say, right, we're ready? Are the numbers, The numbers
are part of it, and the numbers are likely to be less than 1,000 a day for moving between phase 1 and phase 2. And in terms of between phase 2 and phase 3, it could be in the thousands, but not the tens of thousands.
Where was the Maori input in the strategy, please, Minister? What was the Maori input into this?
The way we've designed this strategy on how the health processes will modify, and what we need to do is to make sure that we are working with Maori at every stage of it to ensure that there is that the systems we've set up with Maori continue to be high performing in the environments that we have.
COVID-19 strategy failed Maori. So we're asking what input did they make to the strategy? Not working alongside, but did they help set up the strategy?
So the strategy is an operational strategy that we do need to go out and consult with various parts of the sector on, and we are doing that now.
Why haven't you done that before? Afterwards, why wouldn't that be part of your planning now?
Because the thing that we need to do is to make sure that we have clear oversight of the parts of the government response, the contact tracing, for example, and are able to move the resources around within that. But we are absolutely clear that what we are trying to do is to enable all the good co-design work that has gone on between Māori providers and the government already in the response.
Just on the numbers, I mean, you've been pretty clear about moving it when it's fewer than 1,000, then up to tens of thousands potentially. It sounds like you have some modelling in place. Are you able to share with us what you expect to be the height of the pandemic and when that's supposed to, or this next outbreak and when that's going to occur?
The plan that we've announced isn't based on modelling per se. What we've done is look at a range of different scenarios and make sure that we can think how the response would move at those different stages. So we haven't started saying this is what our outbreak is. Instead, we've imagined a range of different ways it could pan out. So that's why just the fact that, for example, that we have a phase 2, it's not guaranteed that we're going to phase 3, for instance.
Minister Verrall, you said in the opening remarks that this is a mild illness that can mainly be managed at home. What would you say to the critics that would say the government's totally overreacting?
I think the really important thing about Omicron is that it is indeed milder, but it is far more transmissible. And so even if a small proportion of people, a smaller proportion need care in hospital, it may end up being a very large number of people at one time who need that resource. So the pressure on the healthcare resource and the community as a whole can be quite large with it.
So the hospital system is inadequate.
No, what I'm saying is this is a uniquely transmissible virus, one of the most transmissible viruses that we have seen on the planet, actually, and so it provides a unique challenge for healthcare services.
Dr. Bloomfield, what evidence do you have to support your claim about N95s that, quote, if they're not fitted properly, they can be less effective than normal cloth or indeed a surgical or medical mask?
The evidence is from the studies that have been done on these, and that is why those workforces that are using N95s at the moment, in particular our health and border workforces, go through proper fit testing to make sure they are being used properly. So saying, as I said yesterday, some people will be using N95s in the community because they are available, and one of the things we will be doing in our updated guidance around masks is ensuring that there is clear instruction and information for people about how to get the best fit from an N95, even in the absence of doing the full fit testing.
Dr. Bloomfield, can I just ask in terms of the PCR testing, are you going to be testing for the S gene at all?
Well, the S gene dropout is only picked up by one of the platforms that we use to test here in New Zealand, and we have a range of different platforms. It has been useful so far, but we're not specifically checking for that S gene dropout. Instead, we use our whole genome sequencing because, first of all, it's only an indication, and secondly, there are actually two variants of Omicron, BA1 and BA2, and S gene dropout doesn't occur with BA2, and the latter is the one that is rapidly seems to be becoming the more dominant one in a number of countries, and we have seen both here already. So it's not a particularly helpful marker for Omicron per se.
I'll just ask in terms of the contact tracing system, you've obviously outlined how it will change over phases. We've seen with this current cluster already, we've had a New Zealand worker and a kitchen worker at Somerset Village who attended.
Either the case has to identify those people as a contact, and that is subject to error. People might not remember it, or for us to broadcast a location of interest and those people to self-identify as being there and calling in. So it is not a perfect system. There is always a risk that people will not be identified, and as right from the beginning, we've said the goal of the contact tracing system is to identify the majority of contacts, but it can't always identify them all.
The problem with that answer, though, is that the Air New Zealand worker was on the same flight, so that's a pretty obvious connection, and you had a record of who was on flights. The Somerset Village worker was a guest at a wedding. So, I mean, those are fairly clear and obvious contact tracing examples, aren't they?
We'll have to get back to you on the wedding, whether there was any register there. But I think, we'll have to get back to you on the case of on the aeroplane. But in terms of the wedding, it is dependent on people self-identifying.
That's just a comment on both of those cases, and this is not unique. This has happened in our earlier outbreaks as well. Both those cases were identified as cases and were tested because they became symptomatic around the same time, or even or very quickly after our index cases had been found. So subsequently we were able to link the Air New Zealand worker with the flight that this family who'd been to the wedding in Auckland took back to Nelson, but the testing came in very, very close by, and that's something that's happened in our previous outbreaks as well. So this is very often the case that you will get more than one case appearing from a similar exposure separately, and then of course we make the link epidemiologically.
Mikey.
All of the businesses who have had their tests. Could you just outline for people sitting at home why self-isolation requirements have decreased in stage 3 for both cases and close contacts?
Well, in the first instance, actually, we've just increased them up from 10 days for cases and 7 days for contacts because we've gone into this very strong stamp it out approach. So we're trying to, of course, very much slow and, if possible, actually cut off these particular clusters.
Down to stage 3, is that basically living with the virus?
Not at all. In fact, we will just be going back to the lengths of time that we have had in place for through the Delta outbreak. They are still based on the public health advice, so we are not reducing them below what the public health advice is. And that is just to ensure that people are isolating for as long a period as absolutely minimises the risk as much as possible, but there will still be a small percentage of people who might still be infectious after that time period. But in the situation we will be in, with a larger number of cases and contacts, that's a judgment that we think it's worth.
But how does the fewer isolation days minimise the risk?
Oh, well, no, there will still be the isolation periods are designed to minimise the risk of further spread. And 10 days for cases as well.
What the issue is that at the first stage, we are being very intensive about our management of risk while the number of cases are small, but that response can't be sustained when the number of cases are larger. And that by reducing the contact isolation and case isolation period by a few days, we know we only miss a very small percentage, maybe less than 2% of cases, but we overall managed to do our bit to flatten the curve by isolating. Jane.
So when will you give very specific guidance on who will be able to, which industries, which groups, organisations will be able to test to return to work? You've given a broad definition today, but when are you going to name those?
Yeah, that'll be over the next few days or early next week. And currently, government is working with industry to make sure we have the right parameters. It will be a two-step process, so we will enable some businesses first, but we don't imagine we will capture all the businesses we need to from that process, and there'll be an opportunity for other businesses to apply.
Can I just follow? What will that time frame be of that two-step process for groups who may feel they should be included in the first one? What would that be?
That's about 2 weeks away, I believe.
Dr. Bloomfield, can you guarantee that every business who has had its tests requisitioned by the government, the forward orders requisitioned by the government, can you guarantee that those businesses will get the tests that they ordered?
So no one's tests have been requisitioned, and so, however, they have not been requisitioned. There was no guarantee that anyone's forward orders was going to be filled. So the government has acted.
Government policy whereby businesses could get tests but not guarantee that they would get the tests that they paid for?
It is the global supply situation that has led to the situation in which everyone's orders are difficult to confirm. And the action that we have taken has made sure that more New Zealanders will get tests and that more businesses will be able to access them, because otherwise
the government just jumps in and buys them anyway, right?
there is no guarantee that small orders would have been filled in the environment that we are currently in.
Would you just go into detail about what you mean about the action the government has taken? Did you deliberately go over the heads of the government of these businesses to the supplier, and if so, did you offer a premium?
Dr. Bloomfield can outline how the ministry interacts with the suppliers.
Yes, so the conversation I had, which was Sunday morning with Abbott, when we were discussing our forward orders and trying to get as much certainty as possible about how much of those forward orders would be delivered and the timing of those between now and the end of February. During that conversation, I was asked about the orders that that New Zealand-based companies had, and I was asked about whether we should prioritise, or they should prioritise, the delivery to that all-of-government order, and I said yes, that would be the priority for now. Again, I just want to reiterate, businesses will be able to access the tests, and we are already working with them to ensure that they can access tests if they need them. And this is in particular looking forward to phases 2 and 3, and it also an interim measure. If indeed all our orders can be fulfilled as we continue to work with those businesses, then we will, and we have confirmation of that, then of course we will be able to go back to the companies and say, please if you can release the orders directly, please do.
It was as simple as you having a conversation with the supplier and them saying, do you want this to be the process? And you said yes.
That's in. It's getting confirmation of the exact amount that can be delivered and when it can be delivered. And it's changing on a daily basis. And all the time we're looking to see what it is we've got and indeed what it is that businesses need, and we have already and will continue to support businesses to access the rapid antigen tests they need.
Yeah, Henry, sorry, Henry.
I've talked to someone who had a forward order of 100,000 tests due to arrive next week. Their supplier calls them, they say it's cancelled. No one from the government's talked to them. Have you actually gone out to these businesses who have forward orders of quite a lot of tests and said, you know, sorry, we're taking them for now?
So, no, we haven't specifically talked to businesses. I can reassure you there have been plenty of conversations between businesses and colleagues in MB with ministers, and we've been involved in some of those conversations. We are and will continue to work with businesses to look at what their needs are, what orders they had, and if they have needs, then we are able to supply those needs from our existing stocks.
Did you use any emergency powers to do this, or was this all this conversation?
This was a conversation, and this is indeed about ensuring that New Zealand as a whole has access to the rapid antigen tests as much as possible to support not just businesses, but of course the other uses we will have for rapid antigen tests throughout.
Barry.
Tell me what the shelf life for the testers are, please.
The tests we have on order, or the ones...
Antigen tests, what's the shelf life?
It depends on the test, and most of them, for most of them, it's between 2 months and 6 months. Actually, 2 months and 12 months is my understanding.
Yeah. Important Omicron's in the community, but some people in rural New Zealand still have to drive over an hour and a half to get tested, whether it's PCR or rapid antigen. How are you dealing with accessibility issues this time that weren't dealt with last time?
Yeah, a number of ways, and thanks, that's a really important point. Firstly, we already have rapid antigen tests out with community health providers, and we've particularly looked at trying to get them into isolated settings because of that.
Have you been successful in getting them into the isolated settings?
They're in some isolated communities and have been in anticipation of the summer. In addition, distribution of rapid antigen tests at phase 3 of our plan will be through community health providers, through the places you already get tested, such as general practice and other health providers, and community testing services.
The problem
and in addition,
is that there's some places that don't have testing areas. There's places all over the country where you're not going to even get a mobile vax clinic or anything in there for weeks on end. So how are those people going to be tested if this is so highly infectious?
Yeah, and in addition, and I should have perhaps started with this, that we know that I think it's 97% of New Zealand live within 20 minutes of a pharmacy. So that's been another important avenue that we've brought on to support testing during this.
Jessica. Maori haven't been involved in this process. You were just in front of the tribunal at the end of last year saying that it was still upholding the treaty, and now we can see that you haven't actually consulted with Maori on this. Are we going to see this as another treaty hearing at the end of next year?
So 2 things there. First of all, we have had and continue to have regular conversations with a range of Māori groups, including the Māori Pandemic Response Group, and their input has fed into this. Tomorrow I'm on a Zoom meeting with a range of Māori providers and Māori organisations to talk them through this and to get feedback, just as we have been doing through last evening and today with other groups. So we will continue to get input and feedback. And the key thing we're interested in feedback on is how do we make sure that when this is put into operation, that all these measures are able to reach Māori and other communities.
They want 105,000 Māori to be boosted. Will you let them be boosted before the 4-month period? So 105,000 Māori were vaccinated prior to November 1. The question yesterday to you was, will you shorten that time frame for them to get boosted?
Well, one of the reasons we went, as I said, I think yesterday, one of the reasons we went to that shorter interval for boosters, the 4 months, it was the knowledge that a proportion of Māori in particular and our high needs populations had got their initial vaccination course later in the year. So that's why we shortened it to that 4 months. At the moment, there is no firm plan to shorten that further, but I have asked for advice on that, and so I'm expecting that over the next 2 weeks.
You're putting them at risk because they want to go to 3 months, it's only 4 weeks. Why will you not allow them to have that 4 week stand down period? Because you're actually putting them at risk.
The technical advice about what our dosing booster interval is there to protect everyone. And of course, it's a medical intervention, so we rely on expert advice to help us make safe decisions about that. Jessica.
Minister, we've had a level system, we've had a traffic light system, we've now got these 3 phases. What do you say to people who are feeling pretty confused about what you've said today?
So the overall response to COVID is the COVID protection framework with the red levels. But what I know people need going into an Omicron situation where things can change quickly is just a plan in terms of what might change in the public health response. We've seen overseas that things have changed in their public health responses without warning. So this gives people the opportunity to see how within the red levels things might change. And it's an operational framework, isn't it? So it is mostly about how public health systems will run, and many of the points of contact for people will be similar.
Dr. Bloomfield, could I please just get a sense on supply chain issues? Could you please provide a sense of just how severe these issues are? Because pharmacists are struggling to get PPE gear through the One Link portal, which is a portal they use to get PPE for themselves, to have masks, hand sanitizer, so on. Those stocks are out on One Link. So I'm just wondering, businesses can't get rapid antigen tests, but are there even rapid antigen tests and PPE for frontline health people like pharmacists?
Well, I'd need to get the information from you about the pharmacists having a problem. We have a lot of PPE. For example, 145 million medical masks, the ones like you're wearing there today, 25 million N95 masks, and plenty of our other PPE stock. So I'll ask the team to look into what the problem is there with pharmacists actually accessing PPE through OneLink. In terms of rapid antigen tests, as you know, we have millions onshore, and they are being pushed out. For example, over this last weekend, 400,000 tests were pushed out to our community providers to get them ready for these next phases.
Can you guarantee that these frontline people can actually get this equipment from the ministry to use for themselves? Because the OneLink portal says that supplies are out for those products that are listed before, including the rapid antigen tests, for them to use themselves.
I'd need to follow that up and just check what's behind that, but we certainly have good supplies, very good supplies of PPE for all our health workforce.
Gina, and then we'll come down the front, Gina.
Bloomfield, is our system robust enough to filter out fake vaccine passes?
Well, I hope that people are not using fake vaccine passes, and that would be disappointing if they were. Our vaccine checker is designed to validate people's vaccine passes, and it's quite clear that they have been used very successfully over the summer and has really played a part in us being able to get on top of this Delta outbreak. So I guess the key question here is not so much is our system able to detect them. The issue is, and I just want to reiterate, people should not be using fake vaccine passes. That is not the intention of the vaccine pass system.
Question for both of you. Are we now at a point in the pandemic as a country where we just need a complete mindset shift when it comes to Omicron?
I think it's certainly the case that we need to adjust. For many New Zealanders, we haven't been accustomed to having COVID around us, and we need to anticipate that that will change. And that's really important, and why the government has been stressing preparedness. Dr. Bloomfield.
Well, just the comment I would make is that some people talk about, are we shifting to living with the virus? And I think Michael Baker summarised this last year. We have been living with the virus. We have lived with it on our own terms, and we want to continue to do that. And that's why we are putting the planning in so that we can carve our own path in our response to Omicron, that we're living with it on our terms and protecting people to the greatest extent possible.
Just with this latest Omicron cluster, there has been an instance where a close contact has been identified, works for a quite large New Zealand business, has told their business that they are a close contact, and yet they've been told by health officials to isolate. the business owner has said you need to work, health officials have gone in and explained that that is not going to be okay, and they have insisted anyway with the worker that they do come to work. Are you aware of these instances taking place? What's been done and how can you rectify that? And also, does that speak, I guess, to the wider issue around supply chains, people being worried about people not coming to work and fulfilling what the jobs that need to be done?
No, I am not aware of that, but of course we're aware of the potential, which is why we make sure that we provide financial support to businesses that have workers that need to isolate. And in addition, the plan we've described today in terms of supporting the critical workforce, that is important not just for critical industries, but actually for industry as a whole, so that we don't have widespread disruption throughout supply chains.
I think what's been clear to me right through the outbreak is the incredible support that employers have provided by allowing their workers to isolate, and that's one of the main reasons, or a key reason, why we have been able to control our outbreaks, including of the previous highly infectious Delta variant.
Aware of this instance, because health officials have stepped in but have been basically overruled by the employer.
That would be the local public health teams, and the local medical officer of health does have powers, and if those powers include, and in fact, under the existing Section 70 notice that I've issued, that anyone is required, in fact, to isolate for the period that they are instructed to, which, if they're a close contact, is a 10-day period.
Okay, Bridie and then Michael, and that's it.
Bloomfield, so how will demand for testing sort of be triaged in labs? Obviously, the people processing the COVID tests are the same with cancer diagnostics, for example. And they've said that it will be a bit of a struggle to meet the figures sort of quoted yesterday, the surging. How are they sort of expected to sort of meet this demand? Do you guidance go up to them about triaging, and do you foresee any potential that they'll be having to decide between processing a COVID test and a cancer diagnostic or breast cancer specimen, for example?
Mrs. Verrall, you may be as well placed as me to answer that.
Yeah, I think the first thing is that we do need to manage demand in the testing system, and the best way to do that is by how we present for testing, so before it even gets in the system for the lab. So that means that follow the indications for whether or not you need a COVID test. If you've got symptoms, or you've been instructed to by a public health unit because you're a contact, or you're part of a surveillance program. But otherwise, there are samples in the system that perhaps do create more demand than is necessary. So we see pre-laboratory triage and demand management as the most important thing. Sorry, Michael.
Yeah. A report prepared for Candice Manukau, DHB. Dr. Gary Jackson says, once Omicron is circulating in the community, there'll be little to no added risk from overseas travellers. Do you agree with that, and is that thinking incorporated anywhere in these phases?
Yeah, I think the question of whether new imported cases presents extra risk, one of the things that the modelling has shown us is that depends on the scale of your outbreak. So when it's low, as in the case with our Delta outbreak, the relativity would have been quite high, and lots of imported cases can make a big impact then. I haven't seen Dr. Jackson's more recent modelling on that, but I imagine if you have a larger outbreak, as would anticipate with Omicron, that balance will change.
There's a petition going around calling for greater support for the entertainment industry. Do you believe that we are supporting the entertainment industry well enough, and could we see audience numbers grow, cap numbers grow under a phase 3 setting?
So what we've outlined today, all 3 phases occur at the settings that we've set up for RED. And so those discussions about how particular sectors are impacted all relate back to that COVID protection framework. And I don't have anything additional to say except what the Minister of Finance has already said about support for businesses.
Minister, an extra sort of for upgrading masks, even an extra $7 a week can.
That's helpful to go back to is that yesterday the Ministry of Health released guidance on how to make the best of a on the best mask that can be used. And separately, the government changed requirements for people covered by mandates for masks. Look, I think we're pragmatic about masks, and we've shown that all along. We've made a big change yesterday to our mask guidance, and we've talked about other masks in the past, whether we can be using them more. I think we need to keep looking both at the scientific evidence there and the practicalities of making them work in our community.
When can people expect to be able to get hold of rapid antigen tests and be able to use them at home if they're not in this critical worker group?
So in the phase 3 of the plan that we've said today, that there'll be rapid antigen tests will be the primary diagnostic test for someone with symptoms in the community there. They'll be available through the channels you can currently access tests through.
That means you can take them and have them at home and do your testing at home. You don't have to do them at the pharmacy.
So we think it'll have to be mixed. It'll have that will have to offer both options, both a supervised and an unsupervised option because of demand, and that work is how that will be further structured is what the ministry is currently working on. All right, Jason, this is really the last one.
You've been at pains, and so has the Prime Minister, to point out that Omicron is a different foe to Delta, yet Dr. Bloomfield just said that when it came to the Maori perspective being fed in, it was only fed in. There wasn't a specific strategy in mind. So is this in essence saying that the Maori focus or the Maori strategy for Delta was perfect and it doesn't need to change?
No, not at all. And what we need to do, and do, is make sure that we are in regular contact, as Dr. Bloomfield has outlined, and occurs at the ministerial level as well around the strategy. And there was intensive engagement around the COVID protection framework, which this work today sits underneath.
It's a different foe. How come it wasn't specific? There wasn't Maori specifically at the table or really engaged with when coming up with this strategy?
Yeah, so the overall COVID protection framework is a really important point at which we engage with Maori across government. All right, that really was the last question. Thank you very much.
Dr. Bloomfield, so no business is going to get their orders of rapid antigen tests until the government's 80 million are fulfilled.
No, that is not the case. Businesses, this is an interim measure, and businesses can and will be able to access rapid antigen tests, including from the government supply, as and when they need it, to support the plan that we have for Omicron. We are and will continue to work with businesses on that.
Plan, no one's getting anything until you've got yours.
Rapid antigen tests are already widely at use in our health system and in many workplaces.
Where can we get them then?
As pointed out, they're available as a diagnostic test predominantly in phase 3, and they're already being used, for example, in some health worker surveillance.
Members of the public just go to a pharmacy or a grocery store and buy them like they can overseas?
Yeah, because we need to make sure that they're available for those who need them most.